Hey, welcome back in our Ask the Doctor segment today. Today we are talking about menopause, and Dr. Cynthia Jones is an OBGYN with Brookwood Medical Center, here to answer your questions. Good to see you.
Good to see you too.
Thanks for coming in. Menopause is something that is individual to every woman.
Absolutely. Some women have symptoms, some women sail through it without a problem whatsoever.
And different ages.
Yes.
So we have one caller on the line already. We have Carrie in Gadsden. Hey, Carrie.
Hey,
what's your question?
I'm not one of those people that's going through it.
Oh, honey.
Let's see. I'm 42 years old, and I had a hysterectomy, so my menopause was medically induced.
Yes.
The doctor, he prescribed me the estradiol 2 milligrams, and that don't seem to be helping. So we went to buy with a tad bit of testosterone and then DHEA.
Yes.
And that eliminated some hot flashes, so, didn't do as good. The drive is completely gone. The hot flashes, I'm not ill or anything ever, but, I'm just curious what, if my estradiol needs to be raised, because I'm only on 2 milligrams, because I stopped doing the compounded drug.
Yes. Right. Let's let her intervene. Maybe she can ask you some questions, follow up.
2 milligrams is a little bit on the high side for estradiol. It should be enough to replace your estrogen. And you say you're on testosterone too?
Well, that was in my compounded, so, and I quit doing that and just went back strictly to estradiol.
Yeah, you might consider going back just to compounded testosterone to see if that would help, because in some patients that can help give you more energy. Also, there are some non-hormonal medications that are out now that can help with menopausal symptoms too, that you could even take in addition to that.
Right. Yeah, the Bi-S, testosterone, and DHEA.
Yes.
It was like a 2.5, 2, and then 2.5 in that compounded. So, do you think I need to go back? They really didn't do blood work when they, did everything. He just kind of added stuff. So.
Right. You could stay on the estradiol that you're on now and just add a little testosterone to that and see if that helps. So that is an option, and possibly try one of the other non-hormonal options that are out there too. You could try that in addition to that.
All right, Carrie, good luck. Let's go to Bobby, our next caller in Hayden. Bobby, hi.
Hello.
What's your question?
I'm 66 years old. I done went through menopause, and I still wake up in the mornings having hot flashes just in my head. My face is just sweating, and I want to know why.
Okay. Some women will continue to have menopausal symptoms years after they go through actual menopause. Probably about 15% of the population continues to have hot flashes and symptoms for the rest of their life. Again, there are some non-hormonal options that are very safe that won't increase your risk of heart attack and stroke that you could consider. Your doctor would know about those.
Okay, thank you.
Thank you,
welcome.
Bobby. Okay, Janice is our next caller in Raglan, Alabama. Janice, you there?
Yes, I am.
Go ahead with your question.
Yes, I have been taking hormones for about 15 to 20 years, and I'm still taking it, and I'm 60 years old, and I'm still on S-Trace, and I still stay hot continuously, 24 hours a day. My hands and feet are very hot. Is there anything that I can take for this?
Have you had other hormone levels checked, like a thyroid profile checked, to see if that is within normal limits? Because that has been normal. Again, there are some other things that can help with the symptoms that don't necessarily involve hormones. There's a neurological medicine called Neurontin that can help. There's a new medication called Brisdell that can help. But those, you might want to ask your doctor about those.
Okay, I sure will.
So
Thank
she
you so
needs to
much.
follow up with her doctor and see what's going on there. Margaret is in Anniston. Hey, Margaret.
Yes.
Hey, what's your question?
I'm 65, and I have a lot of friends around me that's got menopause, and I never went through that, and I was wondering why, does everyone have to go through that, or is it just some women?
So you never had the symptoms?
No.
Okay.
Oh, some women don't have symptoms. 40% of women don't have symptoms at all with menopause. Count yourself blessed if you are in that group. But a lot of women will go through it and they'll just quit having their periods and then really have no symptoms. And that's perfectly fine too. It doesn't mean anything's wrong with you.
It just stops, you know, and I don't have that. Which is the menopause, it's hot and cold.
Oh, you're lucky. A lot of women would gladly trade places with you.
All right, Margaret. Thank you all for calling in. And I think we hear and talk so much about menopause now that you do feel like if you're not going through it, there's something wrong with you
you're
now.
You're missing the party.
But you're not.
Yes.
All right, Dr. Cynthia Jones at Brookwood, thank you.
Thank you.
Back in a moment.